All right, we are live. All right. Good morning. Welcome to March 6, 2024. This is your Labor, Health, and Social Services Joint Committee to discuss 2024 interim planning and proposed interim topics. I believe we have 34 different topics before us today. Members, you were provided a list of all the interim topics that came in. I hope it was available somewhere on the website as well. Looking for anybody nodding or shaking their head in the audience. If not, it's arranged by legislator name and somewhat alphabetically. So we're just going to probably go through this list topic by topic. Anybody who wants to testify on a topic, 2 or 3 minutes. So whether that's a sponsoring legislator, whether there's people in the audience to talk about that topic, and then at the end, if there's any topics not covered from an agency, and there's any agencies here, we'd certainly be happy to listen if there's any last minute things that came up on your radar. With that, we're not going to call roll because I just don't think it's a necessary thing. So first up, anybody have opening comments, thoughts, problems? Great. Representative Clauston, are you here? You are down there. Proposed interim topic, insurance coverage for medical management of obesity. Would you like to present that or have someone here to present that on your behalf?
I can present it unless there's someone here that really wants to get up and talk about this.
If there are anybody here on the topic of insurance coverage or wants to talk about it briefly, come on forward, but go ahead and give us a quick synopsis.
Thank you. So this was brought to us by the advanced practice nurses, looking at just all the complications, health issues that come with obesity, looking for some work with insurance companies, trying to figure out some way that we can work on the obesity problem in our society. Maybe there's some things that need to be done for diabetes, weight management, weight control, high blood pressure. So again, just trying to put together a group and figuring out what ways we can better coverage, trying to take care of this obesity problem in our society.
Anybody have questions for Representative Clauston? Seeing none, anyone in the audience want to testify on such topic? Seeing none, committee, if you just kind of take running notes for all the topics. Chairman Baldwin and I will probably ask for, your 5 or 8 or 10 topics you would like to pursue this interim, and we'll see if we can find some agreement on some topics before Management Council as well. With that, next up, Department of Insurance Regulatory Authority and Barriers and Issues. Also yours, Representative Clauston.
So this came to us, with the department feeling that maybe they don't have enough authority to enforce some of the rules. They don't have enough staff. So working with that department and with insurance companies, figuring out what they can do when someone isn't following the rules that we passed. So just trying to work with that department, making sure that they can enforce the rules that we put in as laws.
Insurance Department, are you here? Nobody invited the Department of Insurance to this morning's meeting? There's a no-no. Okay. Maybe they'll show up here in a second. Okay. Anybody else want to talk about giving the Department of Insurance some more authority to reduce some regulation and barriers? Welcome, Hospitals and Medical Society.
Good morning, Mr. Chairman. Sheila Bush, State Medical Society. We would have strong support for this interim topic. We've had multiple meetings through the years with both our members and the staff at the Department of Insurance. They do a wonderful job with what they have, but they have admitted repeatedly in different ways their limitations, both in resource and authority. And so I think this is a critical topic for all the work that we do here and the energy we put into the statutes. I think there's an assumption that we leave this building and that there's enforcement or things happen around those laws. And I think that a little bit of attention on this would be warranted.
Mr. Hannes?
Mr. Chairman, thank you. Josh Hannes with the Wyoming Hospital Association. I'd echo the comments of Ms. Bush and just say I think it'd be worth taking a look to make sure that that department has the resources that they need, particularly in light of the bill that this committee just championed and was recently signed into law in the prior authorization. just making sure that there's the ability to develop those rules, enforce those rules, and manage the process once it's in place.
Any questions for hospitals or doctors? Senator Bouchard.
Thank you, Mr. Chairman. I'd just like to hear three specific problems that we need to deal with, rather than just go back and look at a bill that we just passed and moved through. I mean, I'm sure they're gonna come tell us if there's a problem that we need to fix. So can we have three specific problems we need to deal with?
If you have any.
Sure, Mr. Chairman, Senator Bouchard, I don't know that I can identify three specific problems. We met with the Department of Insurance as we were negotiating the language that was in the prior authorization bill. And some of that just leads us to believe that they perhaps don't have the staff. And I think that department, and I don't want to speak for them, but I think you've heard testimony from them before about the level of their capacity compared to other states to enforce rules, laws that are on the books. Like I said, as I sit here today, I don't have a specific result, but I think it might be worthwhile for this committee to take a look, particularly in light of some other interim topics that we hope you take up this session.
Good. I know from all my years in corporations, we were always finding that the Department of Insurance had less authority and less teeth than almost any other state Department of Insurance to pursue on property casualty things. All right, any other questions? Seeing none, thank you both. Nothing else on that topic. Representative Clouston, we'll move on to safe pain management.
Yeah, thank you. So this is, I guess, really high interest across a lot of different areas. I've heard this from physicians, different therapy groups, the nurses. So trying to find ways to have people access to care outside of opioids. It's really easy to take a pill. It's less expensive, but what are the other options to fight opioid addiction? So working with healthcare providers and insurance companies, trying to figure out what we can do to steer people away from opioids and the addiction, the problem that comes with that. So in some states, you're seeing like minimizing or eliminating copays if they're doing treatment for pain that's not related to opioids. So I think this is a huge topic that we can really move the ball forward on.
Anyone here want to talk? You do. Welcome, Ms. Somerville.
Thank you, Mr. Chairman, members of the committee. Andy Somerville, Executive Director for the Wyoming Association of Mental Health and Substance Abuse Centers. We would ask the committee to take some serious consideration of this topic. Obviously, we are the other end. We are treating the people with opioid addiction in our residential and outpatient facilities. One of the things that we do struggle with and work with daily with our clients is those that have chronic pain or other medical issues. We can work with them on treating the opioid disorders, but we still need to work with their medical team to address the ongoing pain issues. We've seen some movement in other states, to Representative Clouston's points, and some alternatives, and we think they're absolutely worth exploring in Wyoming. Thank you, Mr. Chairman.
And you think there could be some statutory updates? I mean, ultimately, that's what we would pursue, is some type of statute changes or allowability to bring in other type of meds or?
Mr. Chairman, I do believe so. I agree.
Senator?
I would ask if we consider that, I would ask for you, Representative, and as you, Andy, to bring us some examples from other states. I know you talked about some co-payment issues and some other things that could be done. If you could bring us those issues, what other states have done, that would be beneficial.
Thank you.
Anyone else on pain management? Representative Harnacker.
Thank you, Mr. Chairman. Just curious what it would look like to incentivize. I don't know what that looks like, and you're incentivizing people that are addicted. So I'm curious what an example would be about that.
And that, if you have any, Representative Clouston, I know you mentioned similar laws in other states, so that's where we would look, apparently.
Yeah, so I don't know if incentivized, like we're not paying people to do something, right? But what they're doing in other states is they're lowering or they're waiving copays. So if you're gonna go to a counseling session to work on your opioid addictions, instead of a $30 copay, in some states that's eliminated or it's $15. There's some funds out there, national funds from opioid addiction and some of the lawsuits that have been settled. So I'm not sure incentivize may be the right word, but making it more affordable to get care to fight these addiction problems or seek alternative treatments.
Okay. Senator Bouchard.
Thank you, Mr. Chairman. If we're going to dive into this area, and maybe there's some healthcare providers out here that could talk about this, but what we have is we've made so much regulation in this area that it has limitations to patients who have chronic pain. So what happens is and I'm sure Chairman Baldwin can attest to this, what happens when they have someone with chronic pain, they have to back off and then they have to almost sit it out and wait till they can come back and give them another prescription because of the way the laws are made. And some of these people are hurting bad. I mean, we can't, the doctor's hands are tied. And now I mean, we have people that have so much pain, and I'm concerned that they get to that level where they're gonna commit suicide because we can't treat their pain. So I think we have to look at these statutes and maybe talk to people at pain specialists, get them in and try to figure out how we can get that legislation or that part of code right. So that way we're allowing the doctors to treat, because we know, we've built all the databases so that way we know who the offenders were, the people that were taking advantage of the system because they were addicted and possibly didn't need a real pain treatment. So I hope that kind of rounds out what, and I'm not trying to hijack what Representative Klaus is doing. I think would be good inside of that topic to talk about pain management.
And reducing some regulations, I think that'd be great. No other comments. We'll move to healthcare insurance payment parity. Representative Klaus.
Yeah, again, this was brought to us by the advanced practice nurses. Looking at right now, if you see your physician, your MD, you get a certain pay rate from the insurance companies. If you see the physician assistant or the advanced practice nurse, sometimes even some of the doctors of osteopath, the rates that they're being paid are different. So what this group is asking us to look at is seeing if they could all be paid at the same level for the same amount of time, the same amount of care. So what you're looking at here is, should we be paying a higher rate for physicians compared to these other professionals?
Anyone in the audience wish to testify on that? Okay, any questions from the committee? We're batting 100 so far, Clausen. Moving on to oversight of compounding of counterfeit medication to healthcare.
So this comes bringing new legislation banning the use, promotion, prescribing of compound pharmacies and any substance often not approved for use as medication. So trying to put a little bit more regulation on some of these compounds that are being out there, making sure that everything that's being given to our patients is safe, has been approved. So this would affect the pharmacy board and probably some of our pharmacy laws.
Any pharmacy board here or any pharmacists? Hey, welcome. I appreciate you sat in the front row. Easier to get to the mic. Thoughts on some statutory things we could do to improve or, I don't know, reduce compounding or how it works? Go ahead.
Chairman Zwanitzer, Representative Klauston, this is a really hot topic right now nationwide. The FDA has taken some stances on medications that were being compounded that were on the shortage list that we all may know. These medications, the shortages are real and compounding is necessary. So if this topic was taken up, we would be very interested in being involved in this topic because it is something that patients need. Not every patient can take a formulated manufactured medication. So I would just caution on being too restrictive on compounding.
And do you think it's, something the state can take on? Is it really a federal issue on the FDA on regulation, or is there some ways the state of Wyoming could improve or proceed?
Chairman Zwanitzer, Representative Klauston, we could potentially look at putting some regulations around that. That would probably fall into the scope of the Board of Pharmacy to monitor that. They currently do inspect sterile compounding pharmacies in the state. It's a pretty rigorous inspection. I don't know further than inspecting, making sure they're sterile, clean, and doing what they should, abiding by the rules and regulations that are currently in place, if they're, what beyond that we could do.
Anyone else in the audience? Thoughts, committee? Yep, Representative Yin.
Mr. Chairman, thank you. I have a compounding pharmacy. I think it's less than a mile away from me. I could walk to it. I want to make sure that we're very cautious in this area because these two drugs, I don't think that pharmacy compounds them. However, I am worried that there is a real shortage of them, and if we basically put a wall around their monopoly, it's going to make access to those drugs even more expensive than they are now. So if we take up the topic, I think we should just be very cautious in the area. Thank you, Mr. Chairman.
And one of them on the list is a semaglutide, which is also a obesity drug. So if there might be some overlap if we're taking on one of those topics to at least go around the edges. Other thoughts, committee? Seeing none. Moving on. We're already at page 4. Everybody's waiting for something. Representative Hornock. Unemployment benefits, drug testing.
Thank you, Mr. Chairman. So most of the language in there, the resources, is just copy and paste of federal code, but federal code actually allows drug testing or the states to implement their own standards when it comes to some of this stuff. And so I'd like to look into the topic of the possibility of requiring drug testing during unemployment. And what would happen? There's a lot of companies in Wyoming that do require drug testing for employers, whether it's DOT drug testing or something like that. When those people are laid off, I would think that it'd be reasonable where the same standard, since the employer pays into unemployment for that employee, for that laid off employee, it would seem reasonable to require those laid off employees still taking unemployment to go into a drug testing program. And it's just a simple, kind of I don't know if it's a random or I don't know if it's a weekly, but setting some parameters so that those people, if the employer is still paying into that unemployment, it seems reasonable that those employees would be required to stay clean during the unemployment process and hopefully incentivize them to really do all they can to get back into the workforce as well.
I think Chairman Baldwin, we've had 2 bills in my tenure, neither of which have made it all the way to the finish line, but I don't think either one were a committee bill that I remember. And it has, I think we were still in the Jonah the last time one of those came forward, so could certainly study the field if there's things different. Anyone here to talk about UI and unemployment benefits, drug testing? Any questions in the committee? Okay. Keep that one in mind as well. Moving on to page 6. Representative Hornock, reducing workers' comp and unemployment insurance tax for employers.
Thank you, Mr. Chairman. I think this being the Labor Committee, we just have not dealt with very many labor issues. And this is something that I think will provide a lot of good incentives to expand employers in the state, to bring them into the state. We do have a fairly high unemployment compensation rate, but we also do have 2 things. We have very healthy trust funds for our unemployment and for our workman's comp. Workman's comp is well over a couple of $2 billion. And so, looking into what we can do to actually reduce those rates for employers. This session, we dealt with a bill that takes some of the some of the gain off of one of those trust funds and puts it into training for employees or potential workforce. I would rather see something like that going to benefit the employers themselves by reducing the rates if we can. But I don't think we as a committee have looked into how these rates are calculated, what these funds are for, how much is in the funds, and what we can do to reduce the cost for employers that pay into these funds, and thus, incentivize business in Wyoming, incentivize people to keep hiring employees, basically. So that's where I'm coming from on this one.
Ms. Johnson?
Mr. Chairman, thank you. Tammy Johnson, Wyoming State AFL-CIO. On the last, both of these two topics, the one prior and this, I wanted to speak a little bit. Last year, Appropriations Committee dove deep into workers' comp fees, then the amount employers pay, and they spent a lot of time talking about that on workers' comp. I don't recall how much they talked about UI, but they did do a deep dive into what employers pay and why the rates are where they are and how they could reduce those. So I think it would be redundant for this topic to be that. I think you could figure out what Workforce Services did with them last year. And I just wanted to remind the committee and Representative Hornock that when UI money goes into a pool from an employer, that's an employee benefit. And so that's compensation for the employee. So if I get $10 an hour and my employer pays $1 an hour into UI, I would be getting $11 an hour if that employer weren't paying in. So that's the employee's compensation package for if they get hurt on the job in the case of workers' comp, or if they get laid off in the case of UI. So looking at that as an employer's fund is it's not exactly the right way to look at it. So bear that in mind as you think about unemployment insurance and workers' comp. Those are employee benefits. The workers' comp is the grand bargain. They give up the right to sue if they get injured on the job. And so that's a pretty catastrophic and big handover. So anyway, those are employee benefits, not employer costs.
Do you remember appropriations coming out with any legislation or anything from their number one topic last year? I mean, I don't, but if there was, I might have missed it.
There was a bill that ran this year, Mr. Chairman, and I think it was successful. It was more about moving around pots of money in the workers' comp division, the savings account, and it was pretty complicated. And it did. I think it did pass this session. So they went from this grand big picture thing, and they kind of just whittled it down to that and looked at that. We would love a deep dive into workers' comp and see that it's not effective. It doesn't cover enough. If I'm single and if I die on the job, the only thing that my family will get is my funeral expenses paid. They get nothing in the way of salary or compensation to my estate. But if I had minor children, then they would get a ton of money. And so because I'm single, and we haven't changed that in a very long time. The amount is up to $10,000 for a funeral, I think, or maybe I think it's 10. But it just hasn't changed in a long time, and we're way behind. And our workers' comp system could use a big revamp. But I didn't bring that to you because I know we did some work on it last year. So.
But there could be some more work to be done.
Oh, there's a lot of work to be done to bring it into the 21st century.
Last year, so.
Yeah, it would be a great labor topic, but it would, requires a big overhaul to make it good. And bring it into the 21st century,
Yeah, it's been 24 years. I guess we're there. Senator Bouchard, question?
Yeah, thank you, Mr. Chairman. Have we ever looked at, inside of workforces, you'll find people that just never get hurt. I mean, because they're good. They're good employees. They're not accident prone. They know their job. Have we looked at maybe taking the workman's comp and making different segments inside where 'cause in the real world in insurance, that's how they look at that person. That person sometimes, that work history travels with them as they go from employer to employer. And for instance, I can remember when I was young and went from being an employee to a business owner, I said to the insurance man, how did you guys get me this great rate? And he said, well, I went to the company and told them we've actually insured you under your previous employer, and you don't have any accidents or anything that happened that we had to pay out. So it gave me a big reduction in my business insurance. So couldn't we take that same concept somehow into workman's comp to try to reduce the cost to employers? Because the employers are just getting hit hard with a lot of, every time you bring on an employee, it costs a lot of money. So we're trying to figure out, I think that's what, to Mr., or to Representative Harnack's point, that's where he's working at. How do we get relief to the employer that's putting that capital out when we have good employees?
Ms. Johnson, if you want to comment.
Thank you, Mr. Chairman. Senator Bouchard, I don't think you're going to like my answer, but one, I think we're trying to liken this sometimes to auto insurance where a driver has lower rates of accidents, so their insurance is cheaper. That would be a great notion. But often it's the employer who's responsible for the accidents on the job. And you should know Wyoming leads the nation year after year in on-the-job death rate. 2 years ago, we were 4 times the national average in on-the-job death rate. Last year, the accident of the year was burying guys in ditches alive. The year before that, it was guys falling off roofs. And it doesn't seem, no matter what we do, it doesn't seem like the message gets through to employers that they can't take shortcuts on the job. They can't hustle workers. There's a storm coming in Teton Village and they're putting a roof on the house. And instead of getting the guys off the roof, they say work faster. So they don't strap in, they don't tie off. So they get these accidents. So, and I will tell you that and this part you're not gonna like, right to work states have 69% higher on-the-job death rate than non-right to work states. And most of that is because union workers are trained to not, they know when to call a job stop, and they're trained to be very safe on the job. And not every industry and not every work training program has that, but union apprenticeships focus on safety first when they're training their workers. So those are just statistics. I don't know, I mean, your stories are anecdotal and I like them, but I wish we could reduce the on-the-job death rate, and I'm happy to help with that in any way I could.
Well, I didn't, Mr. Chairman, thank you. I didn't want to make it about unions. I've never been in a union, and I've worked with my hands all my life. These aren't anecdotal. I have all my fingers and limbs. I
Congratulations.
work
Mr.
very
Chairman.
safely.
Thank you.
Glad to hear it.
Okay, other topics, Representative Hornak.
Well, let me just follow up on a couple of things too. Appropriations did take a deep dive, but what they look at, their focus as appropriators is a little bit different than our focus is as a labor committee. And so appropriations, what came out of that is the ability to reinvest, the income off of these accounts in order to train employees and things like that. So I would like to look at it and from the fact that we do have some of the best in the country investments for workman's comp and unemployment insurance. We have those trust funds set up, and those trust funds are paid in to by employers. It would seem that if somehow we reduced the employer pay, looked into the calculations of how those employers pay into those funds, that the employers would have more money left in their pocket to hire employees. And so that's kind of the more the focus. I know that these benefits are for employees, but it is the employer that kind of pays for most of this stuff. And these funds are not a life insurance plan. These funds are meant to be a help during the struggle times. And the fact that we do have some very healthy funds, as well as a state where, yes, I admit, we do have a lot of death rate. I mean, we do have a lot of injuries because of the nature of the type of work that we do in Wyoming. But the fact, coupled with the fact that we do have healthy funds, it seems like we could look into something of how to reduce that cost a little bit and help employers so that they can hire more employees.
Okay, we're
Okay,
good
Mr.
on topic. Representative Clausen, you have a question?
Not a question, thank you for being here, but this is a topic I'd really like to look at. We're giving property tax relief to our property owners, but most of our income is coming from employers, right? Our mineral industries and that kind of thing. I think if we can lower maybe what these employers are paying, we can attract more businesses to Wyoming. I mean, we have no state income tax, low property tax. If we can make it even more affordable for our employers to be here, I think we can create some more jobs, bring some more employers here. Hopefully some of these benefits that the employers are seeing can be reflected back to our employees. So this is something I've got a large interest in.
Senator Baldwin.
I would just remind the committee, probably a year or two before anyone besides me was on this committee, we had a presentation from these folks, and it was very good. They can give us history. I suspect they still have all those. So I think they can come back to us and give us a presentation, tell us the history. And as the other chairman knows, there's significant history of workman's comp. We were broke at one point, but anyway, that being the point, they do have very good statistics and a very good presentation on this that would be worthwhile for all the new committee members to have that.
We did take significant steps to accumulate, and it perhaps happened quicker than any of us expected, and whether we need to go the other way
Yeah.
now, but yes, there's
Thank you,
a
Mr. Chairman.
large amount of money there.
I won't
Thank
take any
you.
more of your time, but if this blows into a bigger topic with workers' comp, I'm happy to work with the committee on
Hang out with
looking
us all
into
in a room.
that. Yeah, hang
All
out
right,
with you all
we're fun.
session. Thank you.
Next up, Representative O'Hearn, music therapy licensure. And I think
Thank
you
you,
might
Mr.
have some
Chairman.
people here, but go ahead.
Yeah, a music therapist approached me on the email and suggested that adding professionals to the licensure like we have in the past would be a good thing. So a simple little one. I don't know if any of them are here today, but should be, there he is right there.
Anybody wants to talk about music therapy, come on down. Welcome in here. Or-
Thank you, Mr. Chairman. Andrew Schneider, representing the Certification Board for Music Therapists and our Wyoming Music Therapy Task Force. The task force here in Wyoming is made up of 9 of the 11 certified music therapists. They put together a draft for you all to consider of language. This was developed through meeting with the Governor's Health Task Force and then with the Mental Health Licensing Board. So their input is there, and we would love to have you all take a look at it, get your input in there as well. Music therapy is a growing practice, and it's growing in Wyoming. The first state to license was North Dakota in 2011. So we're definitely not doing anything novel here, except for protecting our patients and establishing licensure so that as the field grows, we know that folks have that national certification if they're practicing here in Wyoming. Thank you.
Thank you. Senator Baldwin.
Yeah, the committee got this via email at one point. There's actually a draft bill about musical therapy licensure, so we could take another look at that. And I attended, I don't know if you got to attend a presentation as well by these folks. Pretty impressive therapy.
Nothing else, we could have a presentation, the bill's already drafted, and we could at least have 30 minutes to see if the committee wanted to take it on as a committee bill, something
Thank
like
you.
that.
Yes, Chairman. We certainly would love to bring some patients and some music therapists in front of you and educate you on the practice. I find it really fascinating, and I think we could all learn a lot from how music works in our brains.
You brought some music we could put it like the 3 o'clock in the afternoon time slot, right when we're about to, okay, that'd be great. Representative Yin.
Mr. Chairman, I know we have 2 meetings, I think, scheduled for the west side of the state. Are there music therapists on the west side of the state that would be willing to join us for those meetings?
Thank you for the question, Mr. Chairman. Representative Yin, yes, it would be very convenient to take this topic up in your April meeting when you're in Afton. There is a concentration, although I would say probably 4 or 5 counties have pockets of music therapists. That meeting would be one that would be easy for a group to get to.
Okay. Sounds good. Sounds fun. I mean, yeah, some of the other topics, having a fun one now and then is kind of enjoyable. So, thank you, Mr. Schneider.
We aim to please. Thank you, sir.
Next up, Representative Penn, first topic, provider enrollment with commercial health insurance. Go ahead.
Thank you, Mr. Chairman. So I'll, for the most part, defer to those who are prepared to discuss this, but this is an issue that we see. I know in my clinic and our practice, we do, when a new provider is looking to gain contract with the insurance companies, it can take a long time for that to occur. And so during that time, they may have started working, but they may not have credentialing by any specific insurance companies. And so therefore, a lot of that care goes unreimbursed, and it can be 3 to 6 months. And so definitely an issue that we need to consider looking at. And so I'll turn it to Mr. Hannes.
Hey, Mr. Hannes, go ahead.
Mr. Chairman, again, Josh Hannes with the Wyoming Hospital Association. So Representative Penn did an excellent job describing what we'd like to take a look at and see what we could do legislatively to shorten some of those timelines. Like Representative Penn said, when you hire a new provider, they do have to be enrolled and accepted essentially by the health plan as a provider in that plan. And it can take quite a while, and it has to be done with every single payer that they interact with. It's not just one application, and then you can get paid for services from those payers. So there's quite a bit of burden on clinics and hospitals to get them enrolled. It can take quite a while. The averages that we're seeing from our members is anywhere between 90 and 120 days. Some are a little bit shorter. I would say that, interestingly, the fastest turnaround is with our state Medicaid program, which is somewhere between 24 hours and a week. So I think that in the private sector, this is certainly doable to get those timelines down. And we'd like to take an opportunity to look at other states' regulations and how those work and see what we can do here.
And other states do have statutes on the book that have these timelines or more than we have in our.
Yeah, Mr. Chairman, that's correct. And in my submission, I think I provided links to Colorado's law, New Mexico's, and also Louisiana.
Questions, committee for hospitals? Seeing none. Hey, Blue Cross Blue Shield. Welcome, Ms. Rodet. Thoughts?
Good morning, Mr. Chairman, members of the committee. My name is Heather Rodet, and I'm representing Blue Cross Blue Shield of Wyoming. We're happy to have this conversation, and we've obviously demonstrated our ability to come forward and work with stakeholders. I think if this topic gets picked up, it would be helpful to understand that in some cases, those provider applications are not complete when they come in. And so if we move ahead, we would be interested in having a conversation about timelines when those applications are indeed clean. Because if they're not, then that certainly adds to the turnaround time that's required. Thank you, Mr. Chairman.
This should be easier than prior authorization as an interim topic?
We would certainly hope so, Mr. Chairman.
Me too. Thoughts? Thank you, Heather. Anybody else? Oh, director's just standing up. Okay, I thought maybe you were walking up on this one. Seeing none, we'll go to review of SNAP and other economic support programs. Representative Penn.
Thank you again, Mr. Chairman. So we've had quite a few constituents reach out to me in various conversations regarding our workforce and oftentimes, unfortunately, the lack thereof, and it seems like that's getting worse. I don't think that there's any question that we are low on numbers. You see for our help wanted signs in many of our businesses. The concern is that are we enabling situations where people are not working because they're receiving paychecks from various support programs? And so my thought is, let's take a dive into these programs. Let's see where we can make some changes. I hear from employers, I get people applying for jobs. I don't have difficulty often getting applications, but I don't have anybody show up for my for a job interview. It seems that possibly just the fact of making an appointment to, apply for a job or have that interview is satisfactory to continue receiving these types of support from state entities. And so looking to examine those types of scenarios and see if, are we enabling situations where able-bodied adults without dependents especially can not work, just simply maybe because they choose not to, or what are the circumstances there?
Anyone wish to testify on this one? Seeing none, I'm not sure if we had a good review, but we could probably at least have the department give us an overview of how the systems work and decide if there are some bills there. Next topic, deregulation of childcare facilities in neighborhoods. Go ahead, Representative Penn.
Thank you, Mr. Chairman. So we have been approached on many different in many different circumstances about the need for daycare in our state. It's an issue. We've dealt with bills. We've dealt with various things. And so I would like to approach this from a standpoint of what can we do to cut the barriers and things that are in place that are making these businesses go out of business. So from my own experience, which if you'll indulge me, I'm sure that most of you have heard my stories in the past, but I still have kids in daycare. And so this is an issue that is real to me. We've been dropped from various daycares for various reasons, and them going out of business because of the increasingly difficult hoops that are required to go through in order to have these businesses. Just this morning, I talked with my daycare provider, and I said, okay, so what are some of these issues that we could look at addressing? And she said, ratios. Ratios are a big strain on them, especially when we're talking about infants. Now, of course, we want to be safe. I mean, they're our children. We love them. We want to put them in a safe situation. But I think that some of these constraints that go a little bit overboard. Her thought was she can have more babies, but I mean, and still provide good and safe care, but is unable to because of these staffing ratios. Some of the food service and food handling requirements are quite rigorous. A lot of daycares don't provide meals for their kids because of that. Requires Department of Ag coming in periodically and doing inspections, and it just seems that we end up with inspection after inspection after inspection, and it's just a lot for them to be able to take care of our kids. And so my daycare, they don't do foods. We pack lunches and we do all these things. They can't even make a peanut butter and jelly sandwich. They're not supposed to even put peanut butter on a piece of bread because that's considered, food service and preparing food for children. And so it seems like we have some room to make some adjustments in that. And then another really big issue for these guys is the number of hours that are required, the credit hours. So they're required to have 32 within a 2-year time frame, and 50% of those must be done in person. Oftentimes what that means is daycares get closed so that they can go to these trainings. I know that there's a couple times a year when my daycare is closed for a couple of days because everybody's at these required in-person trainings. Again, we want to be safe. We want to make sure these guys are knowing, good and right things to do with our kids. But looking at, from the medical perspective, we are required to have CE hours and those kinds of things. They're not required to be in-person training. And so I think that, again, there's some areas here that we can hopefully attempt to dive into and open things up, kind of deregulate this childcare situation, and hopefully help bring back some of the businesses that we've lost, or also help make it not such a daunting task. Last night when I was looking at the pages and pages of requirements, I thought, you know what? And actually I have been in that situation where, because I don't have access to childcare, do I quit work or do I start my own daycare? And when you start looking at all of the requirements, the regulations, everything that's you have to do, it's a real chilling effect. And then finally, the other thing that my discussion today brought out with my childcare provider, she said that there are, because of some of these requirements, the food handler's permit, the background checks, some of these, depending on circumstances, some of them are annual background checks, the CPR, all these things, have to be done before that an employee enters the workplace. And they may the employer may, you know, it would cost them a few $100s in time to get this into place. Employee comes in, works a week, realizes this isn't for them, and they're gone. And then you're looking at time to start over, money to start over, and it, you know, it just creates a problem. So I would really appreciate if we could have that opportunity to look into this.
Representative Yin.
Thank you, Mr. Chairman. So I had 3 bills last year and a bill this year specifically for childcare. So I think trying to figure out how we can incentivize increased access to childcare is a great thing. I think the only thing I wouldn't want to do is narrow it to only deregulation. I would think that we should just take a broad overview of how we address childcare in Wyoming. And I think there are definitely rules that have been implemented by DFS that we can take a look at. Maybe they don't make sense, and we bring in childcare providers and see what they have to say of their challenges in providing childcare access in Wyoming. But also, what are the things that people who want to open childcare facilities, what is stopping them, and what could help them create opportunities to create new childcare facilities, especially in places that don't have any childcare at all. So I think it's a worthwhile topic. I just want to make sure that we do it for everything and not just deregulation.
We do seem to have 2 or 3 bills every year, last couple of years, and it might be time to have the committee look at kind of the whole system and what we can do. Okay, anyone else on childcare? Seeing none, Representative Trujillo, workforce program reviews and studies.
Okay, so basically what I want to do is do a complete, really review and study of how the workforce program works in conjunction with Department of Family Services to create maybe some incentives for those. A lot of young mothers that go into family assistance and, you know, assistance end up lacking on the job training for anything. And then when they go to finally apply for work, they don't have the job experience and get overlooked on a lot of situations. And so part of this review, I would like to see how we can maybe help those get the job experience to workforce. And also, I see a lot of community members that go into the Department of Workforce, but yet they never seem to find a job, and they're in the system for like 3-4 years. And I'd like to see why we can't place these community members into positions, and how, I know a lot of this, we just paid for a lot of computers and upgrades and stuff like that, but I know a lot of pushback is workload. And maybe if we can look into computer systems to help our departments handle the workload, especially with today's technology, we should be able to have systems that talk to one another. And that would coincide with the next piece, the workforce program streamlining, that I kind of want them to like be in conjunction. And I know we have a new director, I believe, so I forgot the name of the person, but wanted them to get their foot in the door and get comfortable with where they're at. And then maybe we can all come together and collaborate on that.
Certainly think we could have kind of an overview that talks on a couple other topics. Maybe just have the agency come in, present for a bit, let us ask them questions, and then if we can get some legislation out of it, certainly go that way.
Yeah, because I'd really like to see what can help them help us.
Okay. Thoughts, committee? Thanks. Next up, Representative Ward, medical freedom.
Thank you, Mr. Chairman. So this is regarding vaccine, mask, testing, discrimination, CDC, and WHO jurisdiction in Wyoming. I brought those 2 bills last year and also had them numbered for this year, but they were not considered for introduction. I submitted this as a topic last time for interim, and almost half of us wanted to discuss it, but it was not selected. So I'm bringing it again.
Anybody in the audience want to talk about it? Now that it might have been a couple years and we've all settled in, it might be a good time to review, this happens again and where we, go from here. Thanks. Next up, parental right, oh, go ahead, Senator Bouchard.
Just adding on to that topic, I mean, I think we really need to review where we were pushed by a central government to do things, and we really need to look back. I mean, there's things that aren't in the media, but yet we see it being reported out there through autopsies. We need to look at that and put policies in place so it doesn't happen again.
Other thoughts, questions? Okay, seeing none. Next up, parental rights regarding health. Representative Ward.
Thank you, Mr. Chairman. So this we discussed during our last interim. We drafted a bill, which was HB 44. It passed 12-1 in our committee during the interim and then failed in our House committee. So I would like to discuss with the committee how we can reach some agreement on making sure that parents can access their children's online health records and that children are not vaccinated without parental consent during a public health emergency. I know some of my folks are quite shocked that that law exists even in our books. So there seemed to be large agreement during the interim on this topic, so I was very surprised that it failed in committee, and I'd like to discuss it again.
We have had a lot of parental rights bills in education and other committees, whether we should take a holistic look at it, or I have no idea if management council would assign parental rights as a topic to a different committee, but it does seem to be the hot topic. Representative Yin, paid family and medical leave.
Thank you, Mr. Chairman. So Representative Sherwood had a bill this year that would create a voluntary insurance pool for private employers to join to provide paid family and medical leave. It failed introduction by 1 vote, so it got 41 votes in the House for introduction. And so I thought it'd be worthwhile to help, really help small businesses in the state incentivize as a benefit for their employees, and have that as a broader topic. I know Micah Richardson helped with this going forward with Representative Sherwood, so I'm happy to have her talk on it.
Ms. Richardson, go ahead.
Thank you, committee, and thank you, Chairman Zwanitzer. Yes, we helped with this bill. There are some models in New Hampshire and Vermont that are pretty new, but create an option for businesses to opt in. And we know that having paid family medical leave is a nice option for businesses, and some of them can't afford to do it in a way that would be able to cover their employees. So this is an additional option. We'd also be willing to share some other models that are out there and talk about ways that you all think maybe this could work or couldn't work, and address some of the questions you maybe had, but happy to be a resource.
Okay, thoughts, committee? Senator Bouchard.
Thank you, Mr. Chairman. I mean, I'm kind of lost here because I think we're gonna, talking about standing up another program inside government. So another layer, and then, we have companies like Aflac and things that, is that with that kind of insurance, or would we be competing with that private sector?
No, so what sorry, through the chair, thank you. So what they've done in other states is use like an Aflac sort of thing. And so this just utilizes, they set up an agreement with a private company and can utilize that company to roll out the insurance for this.
And Representative Clausen, hi, go ahead.
Yeah, thank you, Chair. Thank you. I guess following up with Senator Bouchard's comment, is this something the state needs to be involved with, or is this something that private businesses can put together themselves and we could stay out of it?
Go ahead.
Through you, Chair. Representative Clausen, so the models that are out there have it through the state. And the way that this one is set up also is that the state could then access it for their employees. So it starts from the state and then works down, but that could be something that is explored as well to see, is there something else out there? But currently, from what we have seen, working through the state allows that structure for the state employees and then provides that like a one-in place for all businesses to access so that businesses aren't having to individually go to the insurer to get this worked out.
Richard, go ahead.
Just to follow up, Mr. Chairman, I remember back in the days before they mandated car insurance, the insurance man was saying, hey, we got this really great policy, it only costs you $5 a month. And then when we got mandated insurance and government involved, now look at it. And so, I mean, Aflac is pretty low cost where it's at. I kind of think once you get the government involved, it's like, buying a gold faucet in a bathroom. We got to pay more for it because the government did it.
If you'd like to respond, go ahead.
Thank you, Chair. I think, again, it's something to be explored. Because it is a centralized location, I think the idea is that it will help keep those costs low instead of, again, kind of that, the scale, right? So instead of individual organizations going through a private insurer. But again, to be explored.
Guess if we're talking childcare and how it's all gonna work, maybe we could have a quick thing on what the other states do. Representative Yen, you have another topic? And then I'll go down to Senator Hutchins.
Thank you.
Go ahead, Senator Hutchins,
From-
go ahead.
From Micah, thank you, Mr. Chair. Is this like a government meta-share? Is that what this?
Through you, Chair, Senator Hutchins, I am not sure what a government meta-share is. Sorry for my ignorance. If you could help explain that to me, I maybe can help answer better.
I'll do my best. Thank you, Mr. Chair. Meta-share is where people get together, groups of people, and they put into a pool. So if you have or need insurance, you can go through Meta-share to get it's private, or kind of like private, but a group of us, like the committee gets together, we put in a pool of money, and if I need something, I can use it. But what I'm asking is this program gonna be like a government kind of pool? The government puts in the money and the employees pull out of it. Is that what we're doing here?
If you know, Ms. Richardson.
Through you, Chair. From my understanding, the portion that would be government funded would be for government employees. So that would be for your state employees. Anything that will be for businesses, the business could opt to put in that funding for.
Representative Yen.
So, Mr. Chairman, sorry, and I apologize because I clearly didn't clarify what the bill did at all. Essentially, it's a voluntary pool that small businesses can put into to pool their resources as a bunch of small businesses together to get cheaper paid family medical leave insurance as a result. So the goal there is so small businesses can compete with larger businesses, because larger businesses have the economy of scale of all their employees to access cheaper paid family medical leave plans, while small businesses don't necessarily have that ability. So it creates a pool for all the small businesses to do it. The state could participate if it wanted to. I suspect that many members of this committee wouldn't want the state to participate. However, the goal there is to make it purely voluntary, and so any private employer could participate in this larger pool that we would be able to set up and say, private businesses, small businesses in Wyoming, if you want to provide this paid family medical leave as a benefit, this will provide you the economy of scale where we would be partnering with a private insurer to allow for cheaper rates. We wouldn't provide the insurance, we would just be partnering with a private insurer. And that's the model that a couple of states have done, and I assume that would be, if we ever implemented it, that would be the model that we would advocate for.
Okay. Moving on, that's okay. Good? All right, thank you for being here. Next up, overdose Good Samaritan law. Representative Yen.
So, Mr. Chairman, we have Good Samaritan laws that cover emergency responders and that cover doctors and physicians. So if they're attempting to provide services, but something goes wrong, they're not held liable. What this does, the idea of this topic is to make sure that when we're talking about overdoses, that we're trying to provide help first, even if there's someone, their buddy is next to them, make sure that that buddy is incentivized to go help their friend who is overdosing, rather than think about the liability of what would happen if they brought their friend to a hospital. And I think we have someone to speak on it.
Hey, welcome, go ahead.
Thank you, Chairman. My name is Haley Hayden. I am from the CDC Foundation. I am Wyoming's public health analyst for the Overdose Response Strategy Program. If you're not familiar with that, that really just bridges the public health and public safety partners to come together and identifying any gaps that we see throughout the state of Wyoming. One is which, the Overdose Good Samaritan Law. We are one of 2 states left that do not have any protections or anything in place that represent those who call emergency responders or any medical personnel on scene for fear of arrest or prosecution. So we've put together a working group that comes together with our public health and public safety partners to try to create something that would help bring that to our state in Wyoming.
Other comments from the committee? Senator Baldwin.
Thank you, Mr. Chairman. I believe, and I could be wrong, but I believe 3 years ago, there was actually a bill on this very thing, and I don't remember what the fate of that bill was. And I'm gonna say Representative Wilson may have sponsored it, but I don't honestly remember, but I remember I believe it was 3 years ago.
Ms. Bush, maybe you can remind us 3 years back. Go ahead.
Mr. Chairman, members of the committee, good morning. Sheila Bush. It was in 2017. It was House Bill 62. It had a lot of bipartisan support. It came out of the House unanimous, came out of both committees, the Labor Health Committee unanimous. Members of this committee today sat on that committee then and all voted in support. And then it died in the Senate 14-16. Yeah.
Well, we might want to look at it again and bring it back. Other thoughts? Senator Hutchins.
Around in my head properly, you have 2 college buddies sitting together, they're drinking, they're taking drugs, and one of them overdoses, and instead of the one running and hiding because he's afraid to get arrested, he's gonna want to take his buddy to the hospital, drop him off, and maybe we can just do the safe haven for these guys instead of this kind of law. I'm just wondering, was that the scenario that I should be thinking of when I think of this bill?
Mr. Chairman, Senator Hutchings, I think you're real close. Yes, I think the concern is we heard from the testimony at the time primarily came from emergency responders who will arrive at dorm rooms or apartments. And they're lucky if someone has dialed 911, but then they all scramble and there's no one there. And so they arrive to a location with someone who's unconscious and they don't have any idea what's in their system. They don't know what they've consumed. They don't know what's happened. And then they have a lot of, it's kind of a blank slate as to where to start with treatment. And so the intent of this law, and I think the law, House Bill 62 anyway, was really very well crafted, was to allow the opportunity for someone to stay and say, hey, we took these things, or here's this bottle, or any other information that would be critical to make the right decisions in caring for those individuals in that time.
Right, everybody good? Senator Representative Hornock.
How would you envision it working if it's Hugo Chavez standing next to a dead body and he calls the cops because he gave the person on the ground the drugs?
In general, if the person is responsible, I think is what we're asking. If you want to jump in there, or we
Mr.
could
Chairman,
explore that in the interim.
I don't have an answer, but that's a lot of fun. Thank you for that. I have no idea.
Okay. Anyone else? Great. We'll keep thinking about that one as an interim topic. The bill's already there. We could certainly revisit it. Next up, Representative Bien, funding for Wyoming's free and charitable clinics. Go ahead.
Thank you, Mr. Chairman. So I have one of these free clinics, and basically they provide access to those who have no health insurance. And we have quite a few members of those in my community. And so the concern there is that they were able to provide a lot of help through some of the funding that we had in the last couple of years. And it's really trying to make sure that that they're able to provide consistent care in the communities that they do exist in, and seeing what that could mean. It could mean a broad range of things. I just want to have it be explored as a topic in general.
Any questions? Anybody in the audience? Not seeing any? Keep that one in mind. Next up, I think Ms. Butler, are you back? So first, next up would be me and treatment courts. I think she's testifying judiciary. She said she'd be back as soon as she could, so. While Representative Yin is checking on the Supreme Court, next up, on my next topic, addressing the mental health care provider pipeline, specifically addressing the need to help children at a critical development stage. Committee, this came out of a bill we had in the House brought by Chairman Olson that dealt with how to get behavioral analysts, which is a new emerging thing we just did 2 years ago. But specifically, that bill is really how to address autism spectrum disorder. The number of autism cases are increasing in Wyoming each year. And so really some work on that bill went down. There's just, I think, too many questions on how it would work. And it was a bit of a large price tag that came in. Mr. Phil, come on up if you want. And so there's some hope that we would study in the interim to see what kind of programs we do have for kids who either autism or have other spectrum disorders, et cetera. Ms. Defoe?
Sure. Thank you, Mr. Chairman and Committee. Jessie Defoe. Representative Zwanser, thank you for summarizing that. We did have a bill come forward that we thought would be very helpful. We have a lot of parents wondering, how do you provide the care needed for their children during a really time-sensitive window, given the lack of providers and rural nature of our state? And so there were quite a few questions that came up, but we also found that lots of people thought that this was a very worthy topic. And so what we would like to do is help provide any resources and time put into answering those questions and providing parents with an answer that they can be helpful to their children.
Questions, committee? Representative O'Hearn.
Thank you, Mr. Chairman. I think one of the problems was paying the parents $12 or $15 or every time they worked with it. Maybe we could look at just providing the training for them, paying for that as a one-time thing, and then they can take care of their children in a good manner.
Mr. Chairman,
Ms. Pope.
Representative O'Hearn, I think you're right. I think all options are on the table. What we're most worried is about getting the critical care to the children within a time-sensitive window. And so I think that there's many options to pursue with that. And I think all the parents would say, all the above. Let's look into all of it.
Okay. Thank you very much.
Thank you.
Next up, treatment courts. From the Supreme Court, you'll all remember we have been doing kind of innovative work in this area for a couple of years. Ms. Butler, welcome back from Judiciary. We're happy to have you in Labor Health. And this could be a topic maybe for either committee, so we're certainly happy you're presented to both, and hopefully it goes to the correct place. But on behalf of the Supreme Court, what can we do to help increase treatment courts?
Mr. Chairman, members of the committee, my name is Elisa Butler. I'm the State Court Administrator for the Wyoming Judicial Branch. In recent legislation, the legislature transitioned the administration of treatment courts from the Department of Health to the Judicial Branch. So since their inception, treatment courts have been administered through the Department of Health. We are working right now with the Department of Health to transition the administration of treatment courts, and that will be effective on July 1st of this year. One of the things that we've done as a part of that process is we have created a treatment court committee made up of stakeholders who work in treatment courts around the state to try to figure out a way to make them more effective throughout the state. And that committee has identified a few potential statutory changes for the legislature to consider. And so the request that we've made is that those statutes be reviewed and looked at to determine if there are things that we can do statutorily to allow the treatment courts to operate more effectively. I can give you just a few examples of what we've looked at with that treatment court committee. One is some jurisdictional issues. So if you have someone who commits a crime in one county that has a treatment court but lives in another county, they may not be able to participate in that treatment court because they don't live in that county. And so there's some of those kind of jurisdictional issues that exist throughout the state. The other piece of this is we don't have treatment courts in all counties throughout the state. I think they are in 13 out of 23 counties right now. So part of the problem is in some of our more rural locations, being efficient about resources is very difficult because you may have one person in one county that has a treatment court, but you have an entire treatment court team working with that one person. And so, looking at something like allowing for a regional treatment court might be something that this body could consider. So, Mr. Chairman, those are just a few of the examples that the treatment court team has looked at, or committee that we have created. And so would appreciate this committee considering that as an interim topic for this upcoming interim. And I'd be happy to answer any questions, Mr. Chairman.
Any questions, committee? Seeing none. Thank you for being here, Ms. Phelps.
Thank you.
Taking under advisement here. Next up, committee, Mr. Winnie, go ahead, on treatment courts? Yeah, come on up.
Mr. Chairman, Bill Winnie, Sublette County. I'm a member of an advisory committee for Veterans Legal Aid of Wyoming. And we felt the transition to the judiciary just described was a good thing. But there's a lot more work to be done. If you look at veterans, you have a continuum from the suicides on one end. Those are veterans that internalize things. You have the substance abuse, and then you have the more aggressive behavior, criminal behavior perhaps, for veterans that have externalized. What they face is a transition from a military world to a civilian world, and they didn't build up a bunch of protections from dishonesty in the military that they need in the civilian world. So the work being done here, I think, is a good thing. I think you need to talk about it. There's a lot of things going on in other states that can be used as input. So subject to your questions, thank you.
Questions, committee? Seeing none. Thank you, Mr. Winnie. Next topic, proposal to fund 2 critical emergency positions. This came out of I don't think Mr. Wilson's here today, but he basically has worked in this area, saw all the work we did with EMT bills and said, after working in this area, the 2 things we really need are, 1, someone to write grants for all of these kind of rural, our fire districts and our EMS services, and try to get some federal money. And we just didn't have a place in Wyoming to do that. And then also to do like a recruitment director, someone more statewide. And I know we have a Department of Rural Health, but really a person that actually is on the ground, going around, trying to do promotional efforts. Instead of, I think we had a bill for $150,000 for a video. There was some thought that would be better spent hiring someone to actually go and try to recruit around Wyoming to get people to jump in. So keep that on the list if we want to talk more fire service and EMS and the interim. Next up, there just seems to be a lot more issues under your name and my name because that's where people run to the chairman, don't they? Ms. Kaiser, I didn't even call for you. Just knew. I appreciate that. Prepaid funeral plans and master trusts, an issue that I worked on in Corp that we've just had for 4 or 5 years, and we've tried every fix, and it probably needs statutory fix. Ms. Kaiser can give you the quick overview of what the issue is.
Thank you, Mr. Chairman, and thank you for considering this interim topic. Actually, I'm going to pass the ball to one of our members for the Wyoming Funeral Directors Association, Jamie Kirkland. He is online, and he would like to speak to this issue.
Welcome, Jamie. The floor is yours as soon as you turn on your mic and camera. Or at least your mic. Go ahead.
Okay.
There you go.
Good morning, Mr. Chairman. Good morning to the committee.
I am Jamie Kirkland. I'm a funeral service practitioner for Davis Funeral Home in Riverton. I'm a director for the Wyoming Funeral Directors Association, and I'm asking for you to consider the topic of prepaid funeral plans, also known as the master trust, as an interim topic. As you stated, we've done a lot of work on this. Most recently, the governor's special project advisor, Chad Auer, has met with us since last September and advises a comprehensive consideration by the legislature as an interim topic. Mr. Auer emphasized a funeral plan that continues to provide a scope for the investment flexibility and a proper agency. Funeral plans exist for many reasons. Among the reasons are for a family to prepay their funeral plan. Amongst the most important reason is peace of mind and to not leave a financial burden or hardship after they are gone. When a family chooses to prepay, they're able to put the money into a master trust for funeral home with a funeral home. Funeral homes are guaranteeing the price of the funeral until it is needed, making the policy eligible for anyone needing to spend down for Medicaid or veteran benefits. These funeral plans have helped thousands of veterans and individuals on fixed incomes for decades. However, because the Wyoming Insurance Department requires these funds secured government-backed bonds, they have lost money consistently for decades. These losses are documented to be in excess over $1 million since 2015. This isn't just hurting the Wyoming funeral homes, but the consumer who is being physically responsible. Plain and simple, the insurance department is not doing their part. We have shown them examples of other states, most recently in Indiana, how this has been updated through the years. It basically has evolved with the times and works. Our plan would like to update, but we've met a lot of roadblocks with the insurance department. The Uniform Prudent Investor Act governs the management of the trust funds in Wyoming. The trust is not an insurance product and should not be managed by the insurance department. The Administrator Procedure Act does not even address the trust. Basically, the insurance department is not in compliance with their fiduciary obligation to the trust under the current arrangement, and it shows. Our association has put together a group comprised of a bank, third-party administrator, an investor, and a trustee. The fund should be reviewed upon performance of its advisors and investments without jeopardizing the security. It is administered by the association in Wyoming. No one is allowed to withdraw any funds except the funeral director upon proof that the contract holder has died and that services were requested and performed. All of this is done to assure that the customer's money is safely being held until it is needed and growth is sufficient to overcome the effects of inflation. The association is responsible and credible for the people of Wyoming. We are reaching out to you so there is not a problem in the future and no shortfalls for consumers. Thank you so much for allowing me to speak to you today. If you have any questions, we'd certainly like to entertain any.
Thank you, Mr. Kirkland. Senator Bouchard.
Thank you, Mr. Chairman. My question is, how much money is in this trust fund? How many funeral homes participate? And I mean, I would be like, maybe, I think the committee should be emailed some of this information so we could all know, even if we don't take it up as a topic. I mean, this is interesting that we have something that is a problem here and we don't even know about it.
Mr. Kirkland, if you can give us those numbers off the top of your head, otherwise I'm guessing Ms. Kaiser can provide those to the committee. But if you know, go ahead.
Sure, Mr. Chairman, to the committee, Mr. Bouchard, there's an excess of over $6 million in the trust fund. There are over 10 participants in the trust actively right now. I believe there are about 38 funeral homes in Wyoming, and we have about 32 that are members. So every funeral home has access to be involved in the trust because of the restrictions with the insurance department and the non-diversification of the funds. Members are simply choosing not to put their money into the trust. But 6 million, a little over 6 million, about 10 active members in that trust.
Okay. And hi, Mr. Rude. I know that we'll just say it's a very complex regulatory environment, and there's probably good reasons it was put into place many, many years ago. And there's some difference of opinion on whether, well, how we work through it. If you do have comments, happy to hear them, but you're working within the laws assigned to you and doing the best, in my mind, that we can. The question is, do we need to change the process? Representative Hornock.
Thank you, Mr. Chairman. Did I hear correctly, you're allowed to invest in bonds, but so you have to invest in bonds. You can't go onto the open market basically and carry this investment there.
Mr. Kirkland, is that correct?
Mr. Chairman, that is very much correct. We are very much restricted to bonds.
Mr. Rude, quickly from the Department of Insurance, welcome. Could be a great interim topic we can talk about. Go ahead.
Commissioner Jeff Rude, happy to talk about it. If they want to talk about it in the interim, the answer is no. They can go elsewhere. They can invest in Bitcoin. They just have to post a bond to ensure that the consumers are cared for. It's not their money. It belongs to the consumers until the transaction is complete, which is when they pass away and the funeral services are provided.
Thank you much. So that promises to be an interesting topic if you want to take it on committee. Speaking of other interesting topics, thank you, Ms. Kaiser, for being here. Mr. Kirkland. Next up, older adult transportation and adult daycare. Mr. Laycock. Committee, you'll remember we had that PACE study here last year. They came with some recommendations. That price tag was a little high. Asked for some more information on what it would take to make sure that people stay in their homes, but as much as people like staying and living in their homes, they still like to get out and travel around, right? Not be stuck in their homes if possible. So some work could be done in this area. Mr. Laycock, go ahead.
Thank you, sir. Mr. Chairman, Committee, I'm Tom Laycock with AARP Wyoming. We're a membership organization for people 50 and over in the Cowboy State. Over the process of about the last year and a half, AARP, as well as a number of other groups and state agencies, has talked about the question of how do we help older adults get transportation. The reason that's important is simply because we know transportation or lack thereof is generally the thing that sends people into skilled nursing facilities quicker than anything else. The good news is we've discussed this issue for about a year and a half now. We have some recommendations, we have some thoughts. They're kind of interesting stuff, everything from how do we engage rideshare services to help us out, to volunteer, and as well as even processes just for getting reimbursed. So there's a number of things we can talk about, all good things, and we think that we can help people to be able to get rides. This issue kind of shows itself in interesting places. I know there's a central Wyoming county that made it a priority for economic development simply because they would release people from hospitals and people wouldn't leave the room. They didn't have a right to get home. So it's the little things like that where this issue tends to show up. Now you can bundle this. We can talk about transportation on its own, or we can bundle it with the adult day conversation that once again goes back to the PACE study. This is something that PACE is the program for that helped older adults stay in the home by doing sort of adult day with some meals and transportation, as well as getting folks to medical appointments. What we found, or the Department of Health found, I should say, is that there were some issues with the process being very onerous through the federal government. And can we offer some of those services in sort of what they referred to as a PACE light? In other words, the things that people really liked were the transportation along with adult day. We know there's only about 10 adult day centers in the state, none in the state's largest city. And so it's probably worth the conversation as once again, we try to save money. I know I've said it a million times. I apologize for saying it 1,000,001. $5,000 per person per month for everyone we put in a skilled nursing facility under the Medicaid program. And right now, 64% of all Medicaid bed stays are through that particular program. So where you can find give people the ability to live independently with dignity as they age in the home, it's a huge money saver to the government.
Thank you, Mr. Chairman. So my mom actually runs one of these adult daycares in Georgia, and an associated transportation business. From my understanding, the transportation portion is covered, and some of the daycare is covered by their Medicaid, what is it, the home-based, home and community-based services waiver. Is that something that we cover under our own waiver, or would we need to have a change there?
Mr. Laycock.
Mr. Chairman, Representative Ian, would your mom like to move to Wyoming? No. So those services are covered right now, but what we're finding is the reimbursement rates are low enough to the point where frankly, providers don't find it worth their time.
Okay, other thoughts? Thank you very much, Mr. Laycock, for
Thank
being
you.
here. Next up, regulation and taxation of rental housing. Mr. Glass, you're online. 2 minutes. Let's talk about the issue and what the legislature can do to solve it. Go ahead.
Thank you, Chairman Zwaniter. My name is Brett Glass. I'm in Laramie, Wyoming, and this topic involves municipal regulation of rental properties. Now, why should the committee take this up? The answer is because this committee's mission is the best fit for the topic. Housing is an important workforce issue, and social services are deeply involved in matters related to housing. Now, the city of Laramie recently imposed a controversial municipal ordinance regulating rentals. It was copied from an ordinance in Corvallis, Oregon, where rents are double what they are in Laramie. And the Corvallis ordinance was not helping tenants. There are also far more complaints per capita there than we see here. It has provisions that were ruled unconstitutional in other states. It imposes requirements beyond those of state statute, which was written by Senator Phil Nicholas, and in some cases directly contradicts the statute. It requires landlords to do things which may be impossible, even though they make rentals no safer or more livable. And as a result, it's eliminated vital workforce housing within the city. So you can see why this is controversial. It requires licensing of all rentals, even when you rent to a family member. It imposes a tax on all residential rentals and attempts to get around that, the state law, which says that municipalities can't impose taxes by calling it a license fee. It compels speech, requiring the landlord to say certain things to tenants, and requires special measures if a unit has natural gas appliances anywhere in it. It doesn't ban them, at least not right now, but it paves the way for it, as some cities have tried in other states. It also illegally declares that breaches of contract by the landlord, but oddly enough, not by the tenant, are criminal offenses, when by state law they're civil matters and the tenant already has ample recourse under state law. It gives the city manager arbitrary power to bring the landlord into court and subject the landlord to criminal prosecution when you have a simple contract dispute. The ordinance has also not been effective. There've only been a handful of complaints of violation and no positive action has been taken, but it's drained more than $250,000 out of renters' pockets in fees that had to be passed on to them, plus the cost of unnecessary renovations. Now, my family owns a handful of rentals in Laramie. We're not big-time landlords, and we abide by our contracts, but the fees are... Oh, I'm sorry. Okay, am I running out of time here?
Yeah.
Okay, I'm sorry. Well, in any case, I'll sum up quickly. In 2023, Mr. Chairman, you introduced a bill, HB 216, which would have clarified what municipalities have the authority to do. And unfortunately, it was assigned to an inappropriate committee and it died there. I'd like to ask that the committee bring this back up and discuss it because it's an important issue. And it's important that the rules for rentals be equal throughout the state. Thank you.
Thank you, Mr. Glass. Any questions, committee? Senator Bouchard, go ahead.
Thank you, Mr. Chairman. Don't you think this is a local issue? You have elected people there that put these things in place, and that's where you should take care of that?
Through you, Mr. Chairman, that would be so if there weren't conflict with state law. And if it didn't create serious inequalities, you step over the city limits and suddenly the rules are completely different for rentals. We're the equality state, and tenants' rights and landlords' rights should be the same throughout the state.
Okay. There's a topic that's ripe for discussion if anybody wants to take it up in the interim. Next up, review of an update of DFS confidentiality statutes. Certainly under my name, but brought to me by the Department of Family Services. Director Schmidt and Senior Administrator Schilling is here to talk about our priorities. Go ahead, Ms. Schilling.
Thank you, Chairman. Good morning, Chairman, members of the committee. My name is Lindsay Schilling. I'm with the Department of Family Services. This is one topic we're bringing forward as a result underway in the department to stand up a juvenile justice data information system as directed by House Bill 37 from 2022. That was an initiative that worked through the Joint Judiciary Committee at the time.
In addition to that system standing up July 1 of this year, we've also been funded to continue support of community juvenile service boards for purposes of prevention and diversion services. We also have a new case management system standing up September 1st. The challenge that we're running into is each one of those data sets is overseen by a separate regulation regarding data confidentiality, and we don't have a way of connecting the data within the agency to achieve the intent of the legislation. So just a quick review and working through some of those challenges.
Thank you. Questions? Seeing none. Thanks for being here, Ms. Schilling. Take that under advisement. Next up, youth and foster care. I know we have some people here to testify. You'll remember we had the Wyatt group last week, learning the process because they'd like to bring some initiatives and some bills to the legislature in 2024. Welcome, Ms. Sarelson.
Good morning, Mr. Chairman, committee. My name is Sarah Sarelson. I'm the Executive Director of the Wyoming Children's Trust Fund and Prevent Child Abuse Wyoming. I've had the pleasure to work with youth who have aged out of Wyoming foster care. And today I have with me the president of the WYAC, the Wyoming Youth Advisory Council, bringing with you to you topics that have been discussed by about 50 youth who have aged out of foster care, who have ideas on how to make the system better.
Nate, go ahead.
Mr. Chair and committee members, my name is Nathaniel Williams and I'm the president of the Wyoming Youth Advisory Council. The Wyoming Youth Advisory Council kindly asks that you consider these topics for foster care. One is siblings staying together. Two, Medicaid for foster youth. Three, state funding for IL services. Four, placement options at appropriate levels, that meaning anywhere from treatment centers that foster youth are being placed in, and all of that. So, yes, thank you.
Thank you, Ms. Williams. Ms. Schilling, anything to add? Go ahead.
Thank you, Chairman. I'm just here to support with questions if they're already for the agency.
Okay. Any questions, committee? Okay. Seeing none. Good presentation. Thank you. Take those under advisement. I'm done with all my topics. Senator Baldwin, we're on to you. First up is the Wyoming Healthcare Authority. And I think Ms. Davis from the governor's office is here, but if you have any introductory words, go ahead. I can turn it over to Jen.
I'm gonna take a brief liberty here, and that is I'm gonna jump a couple pages ahead real quick, so she can consolidate all her topics here, if that's okay with the committee.
Sure.
If you look on page 25, just bring that one up real quick, just to run through it real quick, and then we'll get to Ms. Davis. And that is the Witchy and Whammy review. This year in the budget, there was a proposal to reduce some money from Witchy. And I think it's valuable for the committee because I think that there's a general misunderstanding of what Witchy and Whammy actually do, what they are, what they compose of. And I think it would be very valuable for those who are going to be here in the next legislature to understand these programs so they understand better. Maybe some changes we could make. And I would just throw out there the one change that I would propose for is changing the veterinarian statutes. They're the only profession under the Witchy program does not have a repayment option. So there I threw it out. So something for you to consider, but I think it would be very valuable to take a morning or an afternoon to go through the Witchy and Whammy programs and understand them better, and perhaps some changes we could make, because they are responsible for a lot of our medical. And that's not just doctors and nurse practitioners and PAs. That's obstetricians, that's podiatrists, it's dentists. There's a number of things under these programs. So they are responsible for a lot of things. So if there's any questions I can answer about them now, I would be happy to, but I think that's important.
Okay. I feel like I brought a bill in 2006 for veterinarian repayment that lasted.
Actually, I brought one, and Senator Barlow's brought one.
And it went away in 2016. Okay, so jumping back.
Let's jump back to Ms. Davis, who actually has several things here. The one being Wyoming Healthcare Authority, the healthcare workforce pipeline development. And she's talked about EMS regionalization, EMS workforce stabilization. And she can talk about those things.
If you want to take all the topics at once, Ms. Davis, that would be great. And then anybody who's here to help with any of those topics can come forward. Go ahead, Jen.
Great. Good morning. Thank you, Chairman. Thank you, committee, for allowing me a few minutes to go through a few of these topics. I'll start with the Healthcare Authority. As you all are aware, Governor Gordon has a healthcare task force, which your two chairmen are members of. And in the discussions, even some that you've heard today, the music therapists, the transportation, some of those have come out or have come to that committee for some consideration and a deeper dive. What we think that the current task force offers is hopefully really an opportunity to learn and dive deep into some of these major healthcare issues with experts around the state, and then bring that information back to you all, especially as we look at things that require some legislative changes. So in those discussions, the Healthcare Task Force has been working really hard to think about how we formalize this and keep it for the long term. As you all know on this committee, healthcare changes just about daily across our nation, and having a group that can keep up with those current changes, dive into the topics, as we know your time is limited, but also having the opportunity to work hand in hand with this committee. We are proposing making that a permanent structure through the Healthcare Authority. You all should have received the proposed language that was developed over the last year and a half from that group. If you decide to take this up as a topic, a lot of that work has been done, and would love to move to the next step for consideration with all of you. We also have some of the Health Task Force members here if anyone wants to add to that conversation regarding the importance of the authority. We have had several in the past. Typically what has happened is they've come up with recommendations and then they dissolve. And then there's nobody to carry that forward. So that's why we think that this is important to put in as a permanent opportunity to keep those conversations ongoing. Happy to take any questions on that one.
Representative Ward.
Thank you, Mr. Chairman, and thanks for being here, Ms. Davis. I'm sorry if you sent it and maybe I missed it, but what is the cost and how many positions are you thinking?
Chairman, Representative Ward, what is in the current proposal was just one position to be a coordinator for that. So it would just be the cost of that. There was no other funding into that. It's really more, I would say, of an advisory group to work with legislation, executive branch, and then partners within the industry.
Other questions on Healthcare Authority? Representative Hornock.
Thank you, Mr. Chairman. Where would you suggest funding come from for this? And then also, it seems like in some way, I mean, we have a Department of Health, and then we have this legislative body, and it seems like the things that come out of the deficiencies or necessary implementations through state statutes should be something that this body here legislatively deals with. It seems like how would you work to set up this task force so that it doesn't kind of usurp some of the authority of this legislative body rather than and work within this structure that we currently have? And then, where would you suggest the funding come from? Since it was originally funded through ARPA dollars, and those are going away. So this would be something that requires legislative funding approval. Thanks.
Chairman, Representative Hornock, just for clarification, this currently has no funding. No ARPA funding has been used for the task force. As recommendations came out of the task force, then you all as a legislative body approved some of those that were put forward as ARPA recommendations in the ARPA bill from a few years ago, but this committee has had no funding for it. The funding that we're requesting within that is one FTE. So it would come out of most likely state general fund as a FTE position, similar to what it looks like with your energy authority for the state. As far as your questions about the authority and the work between the bodies, that's a very good question, and we spent a lot of time having that very discussion. You as a legislative body absolutely need to be critical in this part because you are the ones who develop the statutes. You guys come down once a year for legislative session and then have 3 or 4 interim meetings. And then you all have your other things that you do in the meantime. So you don't have the time nor a lot of the expertise to dig into those topics and really know what is needed from the industry. That is where the Healthcare Authority can step in and assist. Today you heard testimony from Tom Laycock on transportation. That's a perfect example. That group has pulled together experts from the field. They've worked with national experts. They've worked with state agencies to really understand what we currently have in the state, where our current gap is, and then alternatives that we can break down. Then that comes back to you all to say, you know, we've done all this work in partnership with your chairman. Will remain as part of that to say, here's some of the recommendations. Here's what we found out. Now we'd like to see how we can move forward with some pieces of potential legislation to solve these issues. So it's not taking any authority away from the legislative body. It really is an opportunity to have a body of experts to really help you all dig into these topics and really fully understand them. The other part of that is that as we think about the changing healthcare dynamics, you need someone who is current on that all of the time because federal requirements are changing all the time. Medicare, Medicaid requirements change all the time, and it's complicated. And having experts from the field is essential in making that. Healthcare in Wyoming is an economic development driver. If we don't have quality healthcare and providers in Wyoming, you are not going to recruit businesses to the state. People need to have these opportunities. So this is really a body to help you all, to help the executive branch, to really have expertise at the table and bring recommendations forward to you.
Okay, that's the authority. You want to talk about the workforce pipeline development?
Yes, thank you, Chairman. Governor Gordon released an executive order earlier this week to pull our state agency entities together to work on healthcare workforce pipeline. This has been a big discussion over the last couple of years. Workforce, as you all know, is a huge challenge in Wyoming, in all industry, and particularly in healthcare. So as we have been digging into some possible solutions, there's been a contractor who just recently did some focus groups for us across the state with industry in all different areas of healthcare workforce. We are putting forward a group to be intentional with developing workforce pipelines in Wyoming that is involving K-12 education. It's involving higher education, both at the community college level, the university level, industry leaders, to really think about how do we develop a pipeline so that a student who, I'll give a good example that we hear from the public is psychology is one of the #1 electives for high school students in Wyoming. However, they do not necessarily always see a pathway forward, so they disengage from that field. We want to find a way that there is entry level for students who are interested in that, moving into and through a behavioral health pipeline as an example. What can we do with entry level positions? Have those educational certificate opportunities be able to stack on through community college, through university, and be able to really develop our own healthcare workforce. We will be targeting the executive order for the governor, looking at all healthcare workforce with all of you as has been a priority, but really looking at behavioral health and nursing as we found in doing our focus groups, those are the two areas where there is a significant need right now. Again, all healthcare workforce is short, but those are the two areas that we'll really be diving into. We also have support from national leaders through an NGA grant to also help us over the next 9 months develop a pipeline, and then bringing that information to all of you at each of your committee meetings to see if we need any statutory regulatory changes during that period of time.
Senator Baldwin.
Just a quick tag on there, and I know that Ms. Davis is aware of this as well. The WICHE program, which are discussed on your paper, has a behavioral health arm that we've discussed that is available for us too, that we've not utilized very much at this point, somewhat, but it's another potential thing out there with WICHE.
Okay, questions in the pipeline? Seeing none, thanks, Ms. Davis. Let me make sure while you're up here, that covers most of the topics. Unless anything else the governor's office wants to discuss while you're here.
No, thank you, committee.
Thank you for being here. Moving on, we got some duplicity. So sustainability of emergency medical services in Wyoming, Senator Baldwin. You also have EMS regionalization. You want to talk about either one of those, or Mr. Laycock want to come back up and talk about those? Go ahead while he's coming up.
While he makes his way up here, and these are things that you're all very familiar with, that we've talked about in the past. Regionalization is a method by which we can perhaps create regions in Wyoming to better utilize what we have. We have what I like to call black holes of EMS care. We've lost and are losing more EMT providers and emergency ambulance across the state, particularly in our small rural areas, which are predominantly all the way across the state. That's what Wyoming is, small towns. But with that, we need to fix it. We need to look at ways to fix that, and that's something we can deal with. Mr. Laycock.
Thank you, Chairman. Still Tom Laycock, AARP Wyoming. The good chairman just kind of laid out the issue very well. We know where we've gone for the last year. Now, I think there's actually momentum. I think you guys have done a nice job of having initial conversations, really in two areas. First, obviously, the funding. There's been conversations about what does that model look like? Is it EMS districts? Why have we had the EMS district law for better than a year and no one's applied for it? Are there some barriers that we're not aware of? So I think it'd be good to look into that. The second question is really around that one of workforce. Because while we think funding is the biggest issue, if you look at the 2022 listening sessions and report that the Department of Health put out, the bigger question is volunteering as well as workforce availability for that particular paramedic and EMS, EMT level. So those are really two of the big things that we would hope that we could continue that conversation to move forward. There was also, Ms. Davis talked a little bit about EMS as it relates to economic development. I've been an economic developer twice in the state of Wyoming, once at the state level, once the local level in Casper. I've taken the phone call when someone says, what incentives can you offer me to move my business to Wyoming? Step one is always the incentives. What kind of money, what kind of perks can you give me to move to Wyoming? Then things move pretty quickly to quality of life for that person as well as their workforce. How do you get my workforce here? And in and along with that, one of the first things we want to know is what kind of healthcare infrastructure do you have? EMS is a big part of that. And I'm a little afraid if we say, we'd love to have you come to Wyoming, but bring your own Band-Aids, I think we're going to be struggling to bring industry in moving forward.
Okay, questions for Laycock? Seeing none, Ms. Johnson, welcome back. Talking about the healthcare workforce pipeline, associated issues.
Yes, sir, Mr. Chairman, love to talk about workforce. I just want to share with you a quick story, but a quick question first, Mr. Chairman. Are you gonna, we still have a lot of topics to go, 10 minutes to guys gavel in. You gonna extend this?
Probably not, so
Okay.
I'm just gonna jump through. A lot of them are duplicates, so.
Yeah, I just
a
want to
minute.
share with you quickly. Last year, the day after Christmas, the EMS workers in Fremont County called me and they said, we need some help. We are desperate. Our ranks are falling apart. We're losing people. We don't have a solid EMS service. And they handle Fremont County, the largest, square mile county in our state. And they have, with the reservation there, they have a lot of serious medical needs and a lot of transports. So they called and they said, we don't even have enough staff. We don't have anything. So we went in and helped them and worked with the county and they formed a union and they negotiated a contract and they are now almost fully staffed. They're getting paid, before they were getting paid less than fast food workers in Lander. Now they're getting a good wage, they have good benefits, they're getting training, they got uniforms, they have a professional organization that they're seen as professionals when they show up on calls now. And the issues that they were struggling with before have disappeared because they worked with their employer to get those resolved. And they were able to do that because they were allowed to come to the table and talk. I'm not here to advocate that we give unions to every EMS service in the county, but I think you should think about when you apply for a job, think about the first time you applied for the job or the last time you applied for that job. One of the first things you consider is what? What does it pay? Okay? And if it pays $12 an hour, you're not getting EMS workers there. And so that's a very serious issue we have in this state, that we're not taking care of the EMS workers that we have. And I think that we would be able to grow those ranks if we took better care of them and if we figured out how to fund it and how to make sure that they're well paid. That's why they're not at work, because they're not paid enough to do the work. Very difficult and very challenging work. So I think a legislative proposal around this would be to allow public health care workers to have collective bargaining agreements, just like we do for firefighters. And then you would see more people come to the table and get trained to be EMS workers. And we may begin to solve some of the EMS issues we have in the state. One solution, one offer. I know there's others, but I wouldn't be opposed to you guys thinking about that.
I'm sure we all have thoughts on that on this side of the table, and we all, aren't gonna change our minds.
You
but
know,
we appreciate that.
Mr. Chairman, the definition of insanity is doing the same thing over and over again and hoping for different results. And we have never looked at changing some of those workforce laws and workforce barriers we have. We stick to this ideology that we have to have things this way. So, you want to grow, you got to change. Thank you.
Well, that's called the history of Wyoming, actually. We don't change much around here. All right, certificate of need. Senator Baldwin, you want to talk about certificate of need? Apparently didn't make it through your side of the building?
Nope, it made it, and we talked about that during the interim when we talked about it. You guys passed it on the House side. It did not make it through the Senate side because we felt there needed to be some more work on it. So it's just a topic if anybody wants to put out there. There was a lot of input coming from several people in the audience. We could put forward and perhaps do another bill next year.
Okay. We talked about nursing shortages. I'm kind of skipping quickly. Ms. Bush, you'd come up to talk about step therapy. I think that's one of the few things we haven't covered.
Melinda from pharmacy.
And then we'll get to pharmacy after. I'm jumping to page 23 on step therapy reform. And then after that, you're on deck for Pharmacy Practice Act. Welcome, Ms. Bush.
Good morning, Mr. Chairman, members of the committee. Sheila Bush. Step therapy came up in the negotiation conversations on our prior authorization bill this year. As several of you on the committee know, and thanks to our insurance industry partners, we sort of scratched the surface of it and thought we could do a little more in the prior authorization bill because it is part of a prior authorization process in the sense that a physician prescribes a medication, and then it's part of that permission or authority or authorization or ability for that medication to be paid for. But as we got further into the conversation, we realized it is a huge topic. It's very complicated. The states who have passed the step therapy reform, which is almost all of them except us, they're 25, 30-page bills. It's a very similar issue to prior authorization in the sense that there's a lot to it. It's very complicated. But it is one of the more important things that when we got into these conversations about prior authorization with our members and the physicians of Wyoming, that really is where a lot of the tension and a lot of the heartache for primary care specifically is in their relationship with their patients and how that intersects with insurance. And so we would love to be able to have a more thorough conversation around step therapy reform in 2024 with you.
Thank you. Any questions? Seeing none. More PA. Modernizing the Wyoming Pharmacy Practice Act. Ms. Carroll, welcome. And then we're gonna jump to shortages and OBGYN care. I know 3 or 4 of you are here on that topic, so you're up on deck. Go ahead, Ms. Carroll, on pharmacy.
Chairman and committee, Melinda Carroll from Wyoming Pharmacy Association. So for some background on this, the School of Pharmacy at the university was established in 1946. At its inception, graduates received a bachelor's degree. However, the landscape of pharmacy education and practice has undergone significant change. Now graduates attain a Doctor of Pharmacy degree, which encompasses comprehensive curriculum that extends far beyond the traditional practice. The modern education includes in-depth studies on disease state management, preventative care, and public health, equipping pharmacists with the skills they need to play a crucial role in today's healthcare system. Despite these advancements in pharmacy education and the expanding roles of pharmacy in healthcare delivery, there is a stark contrast at the pace at which the statutes governing pharmacy practice have evolved. The last major amendment to these regulations occurred in 1957, a reality that starkly underscores the urgency for legislative reform. The vast expansion in pharmacist expertise and capabilities necessitates the reevaluation and modernization of the legal frameworks within which they operate to fully leverage the potential in advancing public health and patient care. This move will not only maximize the contribution of pharmacists to public health, but it will ensure that Wyoming residents, irrespective of where they live, have better access to comprehensive health care.
Well, don't have any other practice acts on the agenda this year, and we know how much we love them. So pharmacy could be the topic, but it will be, it's been 50 years, so it's got some effort. We could certainly jump into it. Thank you. Any questions? Anyone for access to OBGYN care? I know Ms. Bush, Ms. Davis, Women's Foundation, it's not going in the right direction in our state, certainly the last 5 years. And if there are some things you want to talk about on how to solve it, fix it, or improve it, give us a 2-minute overview.
Chairman and committee members, I'm going to defer a lot of this to these great partners here at the table. This has been a topic of the Healthcare Task Force. We actually have an OB subcommittee that is comprised of these individuals at the table as well as providers. We have a real problem in Wyoming with lack of OB care. Again, goes back to our economic development. It's very hard to recruit business and workforce, especially young families, if you can't have a baby and grow your family. So I'm going to turn time over to the rest of the group.
Right, Mr. Richardson.
Thank you, Chairman. Micah Richardson with the Wyoming Women's Foundation. I'm just going to kind of piggyback onto what some of Ms. Davis has said. As you all know, this is a pretty big issue here in Wyoming. 6 of our 23 counties do not have a birthing facility. We have 3 labor and delivery units that have closed around the state, and we are using emergency services far more than we need to well, actually we do need to, but far more than we'd like to for issues around maternal health. And so we would like to look at this as well. We've come across a few interesting ideas that perhaps could be beneficial in the discussion. And so we're very much in support of this topic.
There are some proposals and some opportunities, options that we could discuss on. Ms. Bush?
Mr. Chairman, members of the committee, Sheila Bush, yes, I think there are examples of best practices that are being employed in other states. Our state, I think I was trying to research but couldn't find it, mid-2000s, 2005, 6, did an enhanced reimbursement for OB services to try and incentivize providers staying here and providing the services. I think it's a critical topic. I won't echo what's been said, but I think it's really important.
Hospitals on board?
Mr. Chairman, yes, sir.
Okay. Any questions? Rep to the board.
Thank you, Chairman. My comments are to this group, but also to our panel. This is a topic I'm particularly passionate about as a doula. And I've had friends in the area who are pregnant who can't find healthcare providers. And I think part of the reason is that certified professional midwives are kind of shunned, and OBs don't want to work with them. So my question is, can we strengthen a relationship between CPMs and OBs so that we're all united in providing good care for women?
Your answer better be, we could work on that in the interim. But go
Yes,
ahead,
indeed.
Ms.
Sure is, Mr. Chairman. And again, have seen some really interesting things from other states to kind of build the strength around doulas and midwives.
Thanks. All right. Thank you all for being here, and it's an issue, right? We know it's an issue, and hopefully we can get it turned the right way. Last topic, Compassionate Care Act. Mr. Murphy, are you still? You are. Welcome. And then anyone who didn't get a topic in on time, you can certainly email the Labor Health Interim Committee anytime today before noon or 1. And then the committee will come and maybe send your local chairman your top 5 or 10 topics that you want to explore, and we'll try to find places that some of these could overlap and be a little bit of a broader issue. With that, Mr. Murphy, go ahead. You have 2 minutes.
Mr. Chairman, thank you. Would it be okay if Max here spoke for a minute and then I followed up with a
Ready?
minute myself?
Max, go.
Yes, I am. Thank you. Hello, Mr. Chairman. Max Esdale. I'm the director of Wyoming Normal. I'm here to advocate for medical access for veterans and seniors with a doctor's recommendation, specifically for chronic pain, PTSD, and end-of-life care. I have seen this help people personally. My father is a veteran. He's 80 years old. He's a 2-time cancer survivor. He now lives with me after being diagnosed with dementia. He is facing the prospect of a 3rd bout with cancer. I want to do anything that I can to help him in dealing with the pain that he's gone through in the past and give him a good quality of life so that my daughter doesn't see him suffer. And so this is very important to me. There's also, it seems, overlap with the pain management, opioid abatement, and medical freedom. And lastly, I would like to submit that the Department of Health and Human Services, the Food and Drug Administration, and the National Institute of Drug Abuse have suggested to the DEA that cannabis be moved from Schedule 1 to Schedule 3, recognizing the medical value of cannabis. This just came out in January. It's a 254-page document, so I didn't bring the whole thing, but I'm happy to provide it.
All right, Mr. Murphy, go ahead.
Thank you, Mr. Chairman, members of the committee. I'm Sean Murphy. Most of you know my story. Just very briefly, I have a very sick child. He has a terminal brain disease, and my whole life has been, really the last 5 years, in end-of-life care palliative type settings. Before that, I actually had a lot of experience. I was prepped for it as a hospice volunteer in the VA. I've been doing that for 14 years. This is what I do, this world of palliative and hospice care. I wanted to bring to your attention today this issue that keeps popping up about medical cannabis, but highlight it more in this idea of medical freedom and compassionate use and right to try. There is a great bill that just passed the South Carolina Senate, and it's called the Compassionate Use Act. And South Carolina's done a great job with their frame on this. It's very focused on medical. There's no smokable products. There's very specific qualifying conditions. It's incredibly tight in its medical regard. And I think that's something that we should be looking at and exploring. South Carolina is doing this right. They have many of the same concerns as I think we do in Wyoming about this genie getting out of the bottle and it turning into recreational. And no, we can do what they're doing in South Carolina. And I think it's important that we do that. I gave you that handout because I think it sums it all up. Why wouldn't we be doing this? We already have right to try acts. We already have this law. And I get it that it's not the law in Wyoming right now, but why wouldn't we be doing this? That's just crazy that we have right to try, but there's something we don't have the right to try. And I know many here in this room, or maybe not many, but some, Mr. Chairman and members of the committee, we know people that they have a loved one that they're giving an edible to. That's what we're talking about here. We're not talking about bags and bags of marijuana. We're talking about an edible to help ease pain. We're talking about very specific conditions, chronic pain, seizure conditions like epilepsy, like my son has. And I think that's what I really want to get across is we know loved ones, and a lot of that is around the demographics in Wyoming. And I think that that's what we can do with this interim topic is think about the demographics in Wyoming. 2 weeks ago, more people turned 65 than at any time in American history. And in Wyoming, we have an older population. We're not exactly a young state. You know, it's not a bastion for people to move back to. So we have an aging, we have an aging demographic, and we have something that can help them. And I think what ultimately we're trying to do and what this interim topic about is let's look at that pathway. How do we get there? How do we explore what others have done and do this that's right for Wyoming to address the needs of our demographic and our population?
Thank you, Mr. Murphy. And if there is a way to tie it into some of the other topics today, that'd be great. With that, any questions, committee? Seeing none, I think we'll either have Clayton or Anna or Donna or Lucas. Are you joining us for the interim? Is our new attorney? Congrats. Welcome. We will try to get some topics put together and then something more formal to send to the committee that you can rank and discuss ideas and add to. And again, if there's any other topics out there, send them to Chairman Baldwin and I by lunch, and we'll try to get them included, even if you didn't get to present them today. Any final comments from anyone? With that, we'll look forward to seeing you all in the interim, at least in Afton and Pinedale, and maybe Cheyenne. All right, have a great morning.